Welcome to Laurel College of Technology Simulation Center. This is our hospital room, and this is Nursing Ann, our simulator. She's a high fidelity simulator who will present to the students different scenarios, different medical conditions. She blinks, she breathes, her chest is rising and falling. She talks to the students. She can talk through a microphone that we can give her voice, or we can use programmed voice over that she speaks to them.
So this is to simulate actual vital signs, which we can control by this little sim pad here. We can make her have an episode where she's coding, she's in atrial fibrillation, and then the students will be here to treat her as if it was a real hospital setting.
So if she even flatlined, we can do CPR on her. We can even shock her and do defibrillation, which is right outside the room, just as it would be in a hospital. This is set up exactly as it would be in the hospital, that we have crash carts filled with the medications that you use. We have defibrillators in here also, so that we can simulate that if we decide to code the patient. On our head wall, we also will be able to run oxygen and suction, so we'll be able to do that on Annie also. Annie is designed to be as close to a human as can be. Her joints articulate and are just like ours. She weighs the same as a human would weigh. Tubes can be put in her, NG tubes. She can be trached. And we can put a trach in her and use trach suctioning. She can have a stoma. She can have a Foley placed in her. She can have suppositories given to her. So you can simulate the experience that students would have in the hospital. This makes it a very safe environment for students to learn from. Annie, poor Annie, she dies and comes back to life. We just push a button and she's back. So the students can do that, maybe make a mistake on Annie. We catch it, it's a mistake you will never forget if even Annie dies on you. Therefore, it's a safe environment. You go to the hospital, you'll remember what you did on Annie and not do that on a patient. But it also gives them experiences that you cannot get in the hospital, but students won't be able to get. We can simulate hanging blood. Students don't get to hang blood in the hospital. We can do that. We can titrate medications on her, put an IV in her. She has spots on her arm where you can put an IV, put it across her chest, and actually can put fluids through it. So then we can titrate meds that they wouldn't be able to do, some insulin, some heparin, some pressors, things to control her blood pressure, and be able to do that. While those medications are going in, Mrs. DeFazio can actually change the parameters, and the monitor will change according to whatever the students are giving. Students give the medicine that makes the heart rate go up, she can push a button and all of a sudden the patient starts reacting to the med. Student may not know what's going on with their patient and realize that it was a medication that they gave that can change the parameters. They can give her breathing treatment and then her respiratory rate gets better. We can change the things as they're doing it so that it is as close to real life as it can possibly be.